Vanakkam. First, I'd like to thank the Indian Association of Public Health Dentistry Kerala chapter for giving me an opportunity. This presentation comes to you from Pondicherry, and famously it is called as the tourism caption is "Give time a break." So please do visit Pondicherry and enjoy the serene beaches and the lovely cuisine of Indo-French cuisine. So with this small introduction, I am Dr. Senthil, and I am an public health dentist and a palliative dentist. So today I'm going to talk about next 15 or 20 minutes. I'm going to talk about dental public health programs. Arise and awake during COVID-19. As a famous Swami Vivekananda's quote says, arise, awake, and stop not until the goal is reached. So we are in a difficult times. So COVID has put us, everybody, mentally, physically, socially, economically, everybody are confused, fatigued. So we need to arise, awake to the occasion and start fighting. So we are going to start with our dental public health programs. So how do we go about it? So the next 15-20 minutes is totally my experience, knowledge, and perception. So I might be right in a few things, I might be wrong also. So whatever good things I say, kindly take it over. So at the end of this presentation, you will be able to know or appreciate or understand the challenges or preparedness we have to do when we start doing dental public health program to reach the masses, because predominantly our main focus is public health and public health dentistry. So I will try to help you how you have to prepare yourself in the forthcoming days, as and when the unlocking is started. And anyhow, they are telling third wave is going to come, but the vaccination drive is going on. So we will definitely come out of COVID and we need to face the reality. So my presentation will be in 4 parts. So first I will be talking about 5 minutes or so about what are all the major challenges that COVID has created. Then are we ready to face the challenges, and how are we ready to face the challenges? Then the lessons we learned, predominantly you can take it lessons I have learned in this 2 years when we were dealing with dental public health program and also with the COVID related scenarios, and the road ahead. So how are we going to face the dental public health programs in the coming days? So these are the 4 aspects I'm going to talk in next 15-20 minutes in 4 parts. Coming into the first part, the major challenges the dental public health programs are facing during this COVID times. More or less, it is similar to other challenges, but I can slightly focus it on to the dental public health programs. What are all the phases? First thing, once this COVID has started, or before COVID itself, this was the test dentistry as a future. Today, my fellow colleagues, friends, public health dentists, and the undergraduates, I will definitely tell dentistry has a phenomenal future, but we need to think whether dentist has a future. So we need to rise up to the occasion. We need to start facing the reality. Don't be scared, because until the human mankind is there, until the industrialization is there, food and change in culture, dental diseases are going to exist. So until human mankind is there, dentistry is there, the dentist will survive. If at all we try to contribute something to the field of dentistry, and during these difficult times, we may have to focus on how we come out of this situation, pandemic, and then focus on the dentistry as dental public health programs. So kindly rise up to the occasion and fight for your rights, and dentistry has a bright future till human mankind is there. Next is, this is the major issue, info epidemics. Recently, there are a lot of confusion, a lot of misconceptions, which creates a lot of challenges for us. Recently, also, there is a lot of social media posts stating that after taking COVID vaccine, people should not go for any anesthetic treatment or any local anesthesia. And our fellow colleagues from oral surgery fraternity has given a statement that this is a very false information. So a lot of false informations are going around us. Even the learned peoples are going into the trap, and we are getting drained out by too much of information sharing, and misinformation and disinformation. So as a learned colleagues, we may have to realize what is required in life and what is the truth behind it. So info epidemics, rather than the pandemic, this becomes the major challenge. to face the information overload, and 70% or I saw 60 to 70% of the information either comes as manipulated. So this is one challenge we may have to face. Because of this thing, we are finally, because of COVID, because of info epidemics, and all these issues, we are mentally weak and socially weak, which has put into a lot of trouble. So be strong. Don't lose your mental strength, which is very, very important to fight the situation. So we Indians are very strong, and we definitely rise up to the occasion. We have seen many challenges in life, and this COVID also will teach us. So we will come out of this COVID and we'll start doing dental public health programs. And today also I see ideally my mobile dental unit is sitting ideally for almost a year or so. So this is again creates a lot of mental fatigue, but we should be strong, and we will definitely come out of this situation as the days progresses. So be strong and come out of the situation. And this is one more challenge. What we are trying to face is uncertainty in life. So uncertainty, see, many times they say with first wave it is over. Now we have crossed the second wave, and most of the states and most of the country is coming down the pandemic curve. We reached the peak and we are coming down, but again now they are telling third wave is going to come. And today, as and when I'm talking this lecture in Madhya Pradesh, they have identified, they are telling Delta plus. And another version of COVID virus is coming, and in Maharashtra they are telling a second and third wave. The third wave will hit in another 2 to 3 weeks. So a lot of confusions are there. We have lost, confused, but this is again a challenge. So if we are mentally strong, physically strong, all these things can be managed, and all these things can be cleared, and we can fight it out. So dear students, postgraduates, whoever listening to this series, uncertainty is there, but we need to face the reality and be strong. So this is one more challenge, and this is one more issue what we are facing, what we will be facing in dental public health programs also. Because of low socioeconomical status, many people have lost their lives, lost money, lost their status, and even NGOs are pumping in money towards COVID. So tomorrow we might not know whether they will support all our dental public health programs. So this is one more challenge. So we may have to find out ways, because most of the organization for the last 2 years, they have been pumping in their money towards COVID. So this is one more challenge we may have to face when we start dental public health programs. So we will see how all these challenges can be met out. So which leads, and one more next confusion is domestic confusion. We might not know tomorrow what is going to happen. Suddenly they will lock the whole city, and slowly they will unlock. And every day there is one rules and regulations. In this total pandemic, there is no caste, no creed, no socio-economical status. Everybody are affected on their own levels. And domestic confusions are going on because they are locking the city, unlocking the city. Every day the rules and regulations are getting changed. The timing of the work timing is getting changed. This is one more challenge we may have to face when we start doing our dental public health programs, because we might not know what time the school will open, how the school schedule will be, or how the community will work, how the society will function. So all these confusions are there to face the dental public health program. I guess with this, my first part is over. Let us go to the second part of my presentation, which is, are we ready to face the issues which is going to come in the outreach program, how we are going to treat or how we are going to manage. So what are all the facts are available to do this dental public health programs in the coming days. So coming into first is workforce. There is going to be a major challenge in handling the workforce. There might be difference of opinions. There might be confusions. One of your own subordinate will tell, I'm not ready for it. How we are going to come out of it. But definitely there will be another person who will be ready to take up the challenge. So as a dental public health dentist or undergraduate students, managing the workforce is a major issue, because the workforce is totally confused now. They are scared, they are worried about themselves, family and everything. So stabilizing the workforce is a major issue. And for a dental public health program, only dentist is not the only key player. There should be other, like your support staffs, your nurses and everybody. So if 20-30% of the workforce is not cooperative, and we may have to face the reality, and so that is where we need to work with shift schedules. So don't strain them more, and we may have to shift them, we may have to give them a comfort zone, we may have to coax them with different agendas and give them a lot of positivity in life and to face the reality. We are in COVID, we know, and last 2 years we have been totally locked down, and dental public health programs have totally shut down. So when we start, there are a lot of workforce challenges will be there, so we may have to alter their schedule and give some flexibility. So for example, if they come for one camp for say your subordinate or your nurse or your social worker needs a break, kindly give them a break, because normally the support staffs will be participating in all of the dental programs, but sometimes they might give you some resistance in participating. So when we go to dental public health programs, now we have a challenge how we need to work on a very ventilated atmosphere, because to avoid again, we should not be a epicenter for another COVID wave. So when we do dental public health program, we should be very, very careful. So that is going to be, see, in earlier 2 years, 3 years before, there was not much concern about ventilation or asepsis or sterilization. When we go to some programs, many programs, we usually focus all these things, but at times. But now it is a time we may have to improve our standards, work on the asepsis, the ventilation level. So right now, I will definitely tell how the mobile dental vans are going to be very useful, because ventilation is the biggest issue there, and overcrowding will be there. So all these things we may have to face the reality. And tomorrow when somebody approaches for a dental public health program, you may have to ask for this. We will increase the workforce, or we will reduce the workforce, or I need a bigger place, I need a bigger environment, or I need a very ventilated place to do my dental public health program. So this is one more thing. And whenever you go for any treatment procedures, dental public health program where dental procedures needs to be done, make sure the dental aerosol generating procedures are minimal, or with very safety precautions you can do, or very, very minimal, at least for another a year or two, till we maximum population is vaccinated or the herd immunity is achieved. So we may have to reduce the aerosol generating procedures, which is also the scientific literature say where the viral load will get increased. And but eventually, when you see the literature in the last 1.5 years, there is not even any fact which says in a dental clinic has become an epicenter. But a lot of the scientific community is telling reduce the aerosol procedure. It is fine, because the viral load is more on the air. It will increase the virus load. But the scientific literature, it is a difference, two different sides of the coin. So to be on the safer side, kindly reduce the dental aerosol generating procedures during your dental public health programs. You can minimize it. And you have a lot of other techniques like ART, and if you take feet and fissure sealants, it doesn't require much of aerosol. And you can definitely do extractions, you can definitely do some hand scalings in your dental public health programs rather than using some ultrasonic scalers and aero tests. So we definitely have an alternative. The science is there, and we have options. So these are the things we may have to face, and we have to definitely, when we go into a dental public health program, you will be as a public health dentist or as a faculty or as a team leading a dental public health program, kindly develop an SOP, standard operating protocol, a comprehensive guide, because it cannot be universalized, because public health programs are localized programs. So it depends on the program. We may have to develop an SOP. We may have to see how the basic COVID protective protocols are followed. Along with, we are also doing our dental public health program. So for example, earlier days, if you are used to screen around 300 to 400 patients in a day with a team of 250, 25 to 30 people, now you may have to see same 25 people can go. Instead of using a mobile van, you may have to use a bigger bus where social distancing can be maintained. At the same time, you can request the organization, if it is 300, 400 people, we need to screen. In a day, we might only screen around 150 to 200, because we may have to maintain social distancing and all other preventive measures. You can, instead of doing a one-day program, you can do a 2-day program. So like this, you may have to develop a comprehensive guidelines which will help you in implementing the dental public health programs, because every day is a learning curve. In the last 1.5 or 2 years or so, every day we are learning something. I have learned something. In the next part, I will be telling what are all the lessons I have learned in the last 2 years. This COVID pandemic has taught me on public health. Going into the next, what is your role in a healthcare system? Kindly, my dentist, it's my kind request. It is not only during COVID times. You may have to see whether we are a dentist or a documentist. So whether you are a dentist or a documentist, because predominantly we are focusing much on documenting things. But we, as a public health dentist or an undergraduate, we may have to deliver procedures rather than documenting. Document is also required, but merely only documenting will not help. So whatever documented has to come into reality. So most of the other healthcare providers consider ourselves we are only documenting things but not doing something on reality. So this is a challenge time. We can arise to the occasion. Whatever we documented or whatever we claim, this is how the dental public health programs are. We can definitely implement it in the community and do some good work. And for say, even if you want to do a dental public health screening camp, you can club it up with a COVID screening camp where your level 1 screening will be for COVID, like your temperature check or your oxygen level check or your basic screening check. Once they pass through these checks, you can take them to the level 2 for screening program. And once they pass through the screening program, you can take them to level 3 for doing some treatment procedures on your campsite. If at all you are capable of doing maximum treatments, that also you may have to reduce. For say, every day in a program you see some 150 to 200 patients. And if you are willing to treat all 150 to 200, I would definitely tell. I was doing like that about 2 or 3 years before. But right now, after post-pandemic, I will reduce the number of procedures delivered at the camp. So at least I will aim for 50 to 60% of the population are getting treated. Remaining people, considering the aerosol cross infection, I might avoid. But that also sounds as because we may have to slowly get back to the normality. So that is where I will tell. So kindly perform your duty as a dentist in a healthcare setup. So not as a documentist. And if at all dental public health programs are facing any tough times in your organization or in your place, don't blame others. It is we public health dentists. So if you point out my principal is not cooperative, or my head of the department is not cooperative, my management is not cooperative, my students are not cooperative, if you are going on telling all these things, first you need to see whether what your contribution. So you go first to the program and you stand first in the line, so everybody will fall in line. If you stand back of the line, and everybody will stand back of the line. So don't blame others. So if your programs are not starting, it is me, it's the problem. So in my organization, if any program is not getting started, it is my issue. And I need to be blamed, not my department or not my colleagues or not my students or not my management. So this is one more thing we may have to face. So with this, I think I finished my part 3. Let us go into part 3. Sorry, I finished my part 2. So let us see what is there in the part 3. Lessons we learned. So next 5 minutes or so, it is purely my lessons I have learned. And after this session, just go home, think whatever I said is right or wrong. So we may have to start thinking what is happening around us, around India, around the world, and what everybody is happening, and who are all gaining advantage of the situation. And we may have to rise up to the occasion. That is what my kind request to my fellow colleagues and friends who are listening to this session. Kindly rise up to this occasion, because a lot of things are grim and a lot of things are confusing. Still, the world doesn't know whether it is a naturally occurred phenomenon or it is a biowar. So many people now, even the developed country, because for many things we look upon US and UK. Initially they said it is a naturally occurred phenomenon, but now they have turned and they've become upside down. They said it is a biowar kind of a thing. So that is the lesson we are trying to learn. We are totally confused. So the first lesson I have learned in this COVID pandemic is nothing is right, nothing is wrong. Many a times we fellow Indians think whatever the Westerners have said is right. But think of the thing, WHO changes its own stand every day. So whatever they said one day before, it becomes obsolete today. So that is the lesson we need to learn. Whatever we do, believe in yourself. And whatever we do, if you have confidence, that should be right for you. So that should be right for your community. It doesn't mean that it should be right for everybody. So that is what how the world works. But all this while we have been thinking whatever the Westerners have said, it is right. But this is the lesson I have learned in this COVID pandemic. First thing is rethink. So kindly, my colleagues, go home, rethink yourself what is happening in the last 2 years, how the world is functioning and how people are functioning, how the countries are functioning, and who are gaining advantage of the situation, who are taking the advantage of the situation. So even in our country, a lot of blame games are going on. A lot of people are taking advantage of the situation, and a lot of people are trying and kindly rethink. And don't be so hard yourself. That is what I will tell. So don't be too hard. So I started rethinking. I told, okay, fine. You have done good programs in all this 10 years, 2 years. Forget it. If you don't do it, no problem. The days will come. Same way in your day, practice also would have come down. And don't be so hard. What has happened? Just hold on where you are. So definitely things will come up, and we will come out of this situation and rekindle the fire. So try to ignite yourself, and you will have one good passion, or you would have had one thought process. Kindly search what is the spark where you get. So rekindle the fire and get ignited, and start doing things which you are capable of doing it. Help the society or help the, see, if it is undergraduate is listening to this lecture series, so if your department is calling for a dental public health program, so they will take definitely all the preventive measures, all the protocols to make you safe, and at the same time we provide some treatment, because this is the major challenge where the dental public health dentist will be focusing. Because when you call upon the team, they will have their own confusion. So kindly, undergraduates, hold on. The public health dentist or the program who is going to take care, they will take all the good measures to make you safe, and at the same time the dental public health program is delivered to the community, and learn from each other. So I am waiting for some department who will teach me how to start a dental public health program, or one day I will start, and somebody will learn from us. So that is what we are planning to do. So as and when we come down of the curve, we will definitely going to start dental public health program. For instance, when we came down of the first wave last February, we slowly started with the dental public health program in my own organization. Definitely, I will tell there were a lot of resistance, but I said, first program, let me go. So we went for the first program, and then we did some 3 or 4 programs, then we ended up with the second wave. So after I finished my first program, I got a learning lesson from my colleague who saw me working. He said, you may have to improve certain things in your programs. So that is a lesson I learned from my colleague after see the way I work. So in my last part, I will be telling about how you should prepare yourself based on my experiences, what I have handled at the end of first wave. So definitely I will be implementing all these things in the days to come. So learn from each other. Then this is one thing majorly I've learned. Today, China is exporting everything. And today, just go and think, if you get the table, like in Olympic medals tables, or Olympics are going to come, which is going to be postponed. Yeah, this is in my lifetime, I'm seeing first time the Olympics is getting postponed because of a pandemic. But like a Olympics table, if you go to the WHO website, just check the COVID meter, and China is nowhere now. So China has exported the disease, and it is exporting solutions also. So I don't know how many people have think how China is exporting solution, and they are the most economically strong country today because they have the maximum production capacity. So this is the lesson we have to learn from other countries. I don't know whether they wantedly created or accidentally created. I cannot go into all those geopolitics in this session, but think what is happening around us, and China is exporting everything. And I will tell you a lot of lessons I have learned from this reality, how things work. That is what I'm going to tell. In the first wave, I think everyone knows about this, because everywhere you go, they are showing you a gun to check your temperature. And in the first wave, they made us buy all these infrared thermometers, infrared guns. When we went back to the literature and checked how much reliability is there, So thanks to my postgraduates who worked on this project, because recently we started searching what is the reliability and sensitivity of all this the COVID preventive instruments, what we are using it in our day-to-day life. And I will tell you an interesting story about pulse oximeter, which is going to be the next slide. Because in the first wave, they made us buy all these infrared thermometers, and the major manufacturer is China. And what is the reality? So when we went back to the literature, definitely I'll tell there is a sensitivity and specificity of this equipment. And there were a lot of meta-analysis were done on the reliability of this infrared guns with the conventional mercury thermometers or electronic thermometer. A lot of comparisons have been done, and they proved this is working. So, but what I've learned is till 2019, I never know this kind of an equipment is available. So that is a lesson I have learned. So from 2020, probably the lockdown, from March onwards, people have started using this. We started seeing this for the last 1.5 years. You would have seen how many products or how many crores and crores of these products you have sold in the market, and who's captivating this. And definitely I tell China is one of the major stakeholders. And there is an interesting story on pulse oximeter. So in the second wave, they made us buy all these pulse oximeters. So I had a confusion whether this pulse oximeter really works. And a lot of social media posts says it also shows oxygen levels for different, even for carrot and different non-living things also. So thanks to my postgraduate who worked on this also, we did a thorough literature search, and the result shows astonishing, because there is not even a single scientific literature. Kindly make a note, there is not even a single scientific literature which tells this pulse oximeters are reliable. So because we got only one literature which was compared with the conventional wired pulse oximeter, and that literature also says it is not reliable, then the whole world is using it and we are doing it. So the second wave, we have bought everything. So how this is possible? So when need arises, we don't look for science. So this is the lesson I've learned. And even though it is a preventive measure, we are using it. I myself is using it, but the scientific literatures are very, very minimal. So when need arises, we don't see for science. We don't see for anything. We need to survive. So this is a place where dental public health programs has to survive. So kindly focus on this, because there is very thin evidence on the reliable sensitivity and specificity of this equipment. But what happens when it comes to COVID-19, the lesson I have learned is there is enough scientific evidences, but people are not ready to accept. That is where we are confused. So kindly rethink. I'm not telling which is right, which is wrong, but we need to think. There is enough scientific evidences for COVID-19 vaccine, but even one of my senior dental colleagues said, I am waiting for an imported vaccine because they are more stronger. But I don't know. We need to believe ourselves. We need to believe our own people. We need to believe our own product. And there are enough scientific evidences they have given, they have established. But people are asking more and more questions, because here vaccine is a preventive measure and they don't want to take it. But pulse oximeter, we advise them, because once the disease has come, you die. So when death is in front of us, we don't look for signs. Or when severity is more, we don't look. I don't know. We are confused here. So kindly think. And these are the lessons I have learned. So last 5 minutes, I'm going to finish the last part. What is the road ahead? Are we prepared? So this part I will definitely tell how we have to prepare ourselves to start the dental public health program, because once we start the dental public health programs, everybody is going to ask what is the scientific evidence, how we can go, and how we will not get communicated. So I have told a humpty number of stories. When we don't want to do something, we will ask for a lot of scientific evidences, and when we want to do something, we will never see anything. So this is the reality I have learned in this pandemic. So our mindset is a basic hurdle. So kindly prepare your mindset, and I will tell you a few things that you may have to come up. And this is one of the famous roads in India. It is a place called Ladakh. You can see this is a beautiful place. I have traveled in this place. This is a personal picture when I was in Ladakh for a dental public health program in 2016 and 17. I took this picture. So public health programs are astonishingly good. We can enjoy anything. So this is one enjoyable moment. I had it in 2016 and 17. And coming into what is the road ahead, prepare ourselves. Stigma. This is the major issue. Social stigma is the major issue, or the stigma among the dental public health dentist or the dentist or the community. So get out of the stigma, and science is there. We are educated. We know what is science, and we know what is evidences, and we know how to protect ourselves. Then mobile dental van. Normally, I don't endorse mobile dental van, because normally I call this mobile dental van as a white elephant. So for Indian roads, it is not at all suiting, and we cannot treat much patients. And in COVID times, I don't know how far we are going to use this mobile dental vans, because no ventilation, congested, only two people can be treated. So we may have to come out of mobile dental vans, and we may have to do our programs in a bigger places like community halls, or in playgrounds, or in basketball grounds, or in a football ground. So more ventilation, more spacious, and more people can come. So definitely you can ask, if you are going to go for a school camp, you can ask. We will definitely do it in a community hall or in an open space, where a better protection is there. If the school is having a better facility like indoor stadium, definitely you can do it. So I don't know how these mobile vans are going to be very useful, because it is already congested, no ventilation. So we may have to come out of this mobile van concept and start exploring beyond mobile dental vans. And mandatory vaccine, the team which is going to participate, you can make sure the team is getting vaccinated. So that is one more thing we have to face, and you have to make it mandatory that if you want to learn something, if you want to come for camps, get it vaccinated. So this is one thing. And personal protection, this is what I have learned in my last camp. So proper face cover will do. So no need of many people tells we need a PPE kit and all these things. How do we work? So no, we have learned a lot. Last 1.5 years, we have completely understood what is this COVID is and how it portal of entry is. And in a public health program, we are not going to see all COVID patients. When we are seeing all COVID patients, probably the full gear is required. So in a community setting, when the positivity rate is very less, definitely a proper face cover, an N95 mask with superadded with a 3-layered mask and a head cap and a face shield will definitely help you in protecting yourself. But you should wear it properly, because many times I have seen, because of the work pressure, many of my students, not during COVID times, before COVID times, they forget to wear a mask. The mask will be there like a chin guard. So we may have to start learning, and we may have to face to work with this reality. So this is one more thing. And innovations, try to do a lot of innovations, because India is we are very strong in human manpower. There are a lot of dentists who can think crankily, and definitely for dental public health programs, we need a lot of innovative thinking. So we are trying to do a lot of innovatives. I've been doing, I normally don't do much camps in my mobile dental van. It will be in open space, which I've been doing it for a long. So that is the thing. Next, I want to basically tell you. Then coming into creating awareness. So create a lot of awareness about COVID, and also about dental public health programs, and also about you are safe. Again, we can do some treatments because all are vaccinated. If you are also vaccinated, even in dental public health programs, you can allow patients who are vaccinated. So that can be easily checked, because the government has a very good database, and definitely you can allow participants who are vaccinated. So if both the sides are vaccinated, the disease transmission level is very, very less. And provide treatment to the stakeholders. For say, if you cannot treat the outsiders, so simple logic to start a dental public health program, you can start it from your own institute, where your workers, subordinates, their families, even your attenders, even your sisters, they might need a lot of dental treatments. Just go back, and we may have to start working from ourselves. So you can go into those places where the people are available. Even the security people who are standing outside the dental college have a lot of dental issues. So start focusing on them. Start a treatment for your own drivers, own security guards, subordinate, non-teaching staffs. So we can start doing some programs for them. So their families. So it is going to be a bigger task. So these are the things you may have to get it prepared. And I think I have finished my presentation with this. So thank you very much. Mikka Nandri. This presentation comes to you from Pondicherry. And I hope I've discussed about what are all the challenges and how to come out of it, and how do we face dental public health programs in the future. So kindly think, rethink, and nothing is right, nothing is wrong in today's world. Thank you very much for the patient listening and for this opportunity to Indian Association of Public Health Dentistry, Kerala chapter.